This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard Incorporated. Our job, our task, is to inform, to educate, and connect our seniors and those that care for seniors with the resources that are available in Brevard County. And I'm finding, and we're going to talk about it on the show, both from a dental perspective and from just a simple care perspective, about examples and cases about how people help people. And my panelists today are Dr. Sheldon. You there, Doctor? We're getting him on here, folks. But in the meantime, while we're getting him on, I got Dr. Kerry Fink sitting on the other side of the glass. Welcome, Kerry.
Welcome. It's good to be here.
Yeah, it's glad to have you here. Now, if we can get that dentist on the line.
Yeah, well, yeah, sure.
What dentist are you talking about?
Oh, there he is.
Yeah, there he is. There's the dentist just on here with us. Welcome, Lee.
Hi, Joe. Hi, Kerry.
Hello.
Hey. That's the first. Did you hear the music, John? Or Lee?
No, I didn't.
Yeah, you missed that. It was the music that we used years ago when we first started the show. And I don't know how John found that music, but it's nice to have it. It's nice to talk about and remember some of the things that you've done as you live your life. And I'm sure that we're going to talk about that a little bit today, but because it's so important. But the sponsors of this show, folks, are organizations. One of them is Dr. Sheldon, our panelist today, but other organizations like Kindred at Home, the Eye Institute, Dr. Sheldon's, I mentioned him, Zon Beachside, Hibiscus Court, just to name a couple of them. One of them has been Bill Johnson, an elder law attorney, and one of our new sponsors is a lady that I'll mention because I turn to her a lot when I'm trying to solve problems. That's Barbara McIntyre of Reverse Mortgage. I find that seniors are getting themselves in trouble more, Lee and Kerry, simply by ignoring what they have to do when they make an agreement. And I would, Lee, we're going to talk about dentistry with you today, but what would you say to, or how would you feel about somebody you described a dental plan to, and you got started on that plan, and then they decided they wanted to pull out of it or stop it after they got about halfway through? It'd be a problem, wouldn't it? Yeah, we lost Lee there for a minute, but we'll get him back.
That would be a complicated scenario, I'm sure.
Yeah, I think it would be, but while we're trying to get Lee back here, let's just talk a minute, Kerry, about in our organization. Stories are mean a lot to a lot of people, and stories can often help solve problems, and I can say that based on some of the things that have happened here since I've been answering the telephone for Helping Seniors over the last 3 months. I thought, folks, for all these years that I was really, really in tune with some of the problems, and I've been writing about this stuff in the paper. But I find out that there's just a lot more that we can tell a person, show a person, help a person understand what they should do, and then they don't do it. And I'm thinking here about a family that had entered into a reverse mortgage.
Mm-hmm.
I got a call from the people asking for help. And I said, let me call somebody I think understands this. And I called Barbara, and I talked to her about the problem. This family had been foreclosed on. Their home, they were going to lose their home. And as I got into it, I found the home was evaluated, would go on the market for about $220,000. They had taken $160,000 reverse mortgage on a home, spent the money, and didn't keep up the home owner's mortgage.
Oh my goodness!
And by doing that, that meant if they lost the home,
right,
then the lender would be out his money.
Yes.
So here are two people, one disabled and one quite elderly, are going to lose their home, and they don't have the money to go out on the open market to pay for a home. So when you start getting involved in cases like that, and you see where, and I started asking questions, and I found out there had been a bankruptcy involved, and I found out that the people had simply put the bills in boxes, so to speak, and did not do what they should have done. No. And so many times it's just like people taking out a credit card.
Sure.
And getting credit card debt, not paying down the debt,
right.
and all of a sudden getting in trouble.
Right.
And I'm sure in your work, in your ministry, that you've seen that happen.
Yeah, it's a tough thing because there are so many people who are challenged, and it's not just specifically a senior issue. It's just an issue that a lot of us from time to time run into situations that we fail to plan for, and that I think is really the importance of what we try to do with helping seniors, is because, as we've often said on this radio show and on television shows and things like that, aging is on the job. You don't know until you get there, but it behooves all of us to do everything that you can to prepare, and half of that preparation is just learning and knowing your options. And as we've talked about again on the radio show over and over, is the fact that sometimes money is a solution, but a lot of times the information is what leads you to the solution. And in the case that you were just describing, obviously, you're like the poor fire person from the fire department who shows up at the blaze and you're trying to put out embers. Whereas a few years back, if that same person had called, say, look, here's where I'm at, I need some advice trying to figure this out, there was a lot more options at that point. I think if you would ask anybody in the fire department, they would say, we'd rather come over to somebody's house and tell them what might go up in flames than have to be here to put out the embers. And I think that's what we try to do every week with helping seniors, whether it's in the articles you write, whether it's in the radio shows, the TV shows. It's all about helping and equipping people so that they learn some good tips and maybe avoid mistakes other people have had to suffer through.
Well, you're exactly right on target, because if we live our lives expecting somebody else to bail us out, and I don't care what age you're at, whether you're 20, 30, 40, 50, 60, 70, or 80, you're making a tremendous mistake. I find that a lot of the calls that I was getting over the last few months were people, not a lot of them wanted to know where to go for help. I had a lady that just moved into the area. She wanted to know about transportation. Well, I told her, and I asked her where she had come from. She told me. And the poor lady had a stroke.
Oh, my goodness.
And she cannot drive. So here she comes to Brevard County to live. And I think everybody listening on this network knows that the transportation is extremely limited.
Right.
And so, all I could do was tell her that about SCAT. I could tell her about Uber. I could tell her about vets driving vets. I could tell her about some things that are, that the county has. I could tell her about the Alzheimer's Foundation with their transportation. And by the way, they do a tremendous job. They'll take I even found out, I had people call that needed to go to Orlando for cancer surgery. And they needed a wheelchair van. Heck, the Alzheimer's Foundation takes people to Orlando, and there is no set fee for it. They only ask for a donation. Now, you get a good tightwad that'll take a transportation to Orlando and give you somebody a $5 donation. That doesn't even you think about it. They have to those vans that they get from the county cost roughly $700 a month.
Oh, yeah.
They had to put the gas in there, and then they have to pay
the driver.
to drive the driving.
Yeah.
And so here's the Alzheimer's Foundation. They get money from the Department of Transportation, but at the same time, they'll use that now. And I'm finding out a lot more about what their services are. And folks, this is what we're trying to do on the show today is really make you aware that if those of you that know people that need help, you can get them to call us, or they can make some phone calls yourself. You start looking on the internet, start asking, just type in on the internet what service you want. You'd be surprised what comes up.
Well, see, that's what's so interesting about what you just said from a caller who's just moved into this area, doesn't really know where to begin. I was literally counting as you were going through the different options. You came up with 6 different options that I'll bet that lady didn't even know were even available to her. And again, that's half the battle. If somebody knows, okay, at least I have, there's a place I could try over here, I could try over there, you're bringing a little bit of hope and potential solutions for them.
That's exactly right. Are Lee on?
I'm back.
Hello, Dr. Sheldon. Welcome.
Thank you, man. Thank you.
Yeah, listen. Okay, don't turn off your cell this next time. Don't drop it down any patient's mouth or anything like that.
Why, did you hear an echo?
You know, Kerry and I were talking about examples of how people need to call helping seniors to find out what really is going on. But one of the things that I was going to ask you about was what are the first things that you're as a dentist, what do you think about when you see a new patient, somebody you don't know from Adam, they come in off the street? And the reason I ask that question is because I think about when I went back to boot camp in the Navy many years ago. I thought I was going through an animal production place, and I think I told you the story, but I thought the guy didn't know what a drill was, but he knew what a chisel was. I felt like I were breaking my teeth out trying to fill them. And you've assured me that that stuff has changed. But what do you think about it? Because I could tell you some stories.
It's interesting because when I was in the Army, I felt one way, and in private practice I felt a different way. I suppose when I was in the Army, people had to come in and see me. They were required to see me once a year. And of course, I was seeing a younger patient population at that time. I wasn't a specialist. I was a general dentist in the Army. It was kind of a required thing. You would see some patients who were just in horrible shape, particularly those when I was at Fort Sill, Oklahoma, just out of dental school, 25 years old. And I was seeing these kids who had gone into essentially basic training, and they had to lose their teeth. They had to lose their teeth pretty quickly. It's kind of depressing. You see a 18-year-old who's got to lose his or her teeth. But, it was part of what we did. We extracted teeth, we put in dentures. That was just the way it was, and people function the way they function on dentures. Here, it's a different story. I guess part of it is because of my age or reputation or whatever you want to, or marketing or whatever it is. It's a different kind of patient we see, and essentially, it isn't just one thing that I've got to look at. The first thing I have to think about these patients, because many of the patients that we see are people who have been away from dental care for a long time, they were turned off for whatever reason, is what can I do to reestablish a relationship with dentistry? A lot of these patients that we've seen have been gone for 5, 10, 15 years longer, just because of their bad experiences. And so it's not just reacquainting, it's kind of reassuring that in fact you can get something done, and perhaps this is the right place to do it, and that takes a lot longer. It does. It takes some time to work with a person and to talk with a person and to have an understanding as to where the person's coming from. And like any of us, we come in with this big overcoat where we don't want to reveal anything, and it's kind of you have to take the layers of the overcoat off in order to be able to find out what a person is really thinking, what a person really wants.
But Lee, think about.
I think So
Lee,
that's my first goal, is to just get the person comfortable, because the treatment won't be done, and no matter what the treatment is, whether it's a little bit of treatment or a lot of treatment, the treatment won't be done unless that relationship is reestablished with dentistry and some confidence and reassurance is given on both sides.
but when you see a person just coming in off the street, and you put that bib around their throat, and you ask them to open their mouth, and you take that little piece of metal you got in there and your light, and you look in there, and you're moving the jaw around and everything else, and you see stuff on the surface, and as a dentist, and it's something I've always wondered about, a doctor goes in and opens a patient up, and they might find, thinking they're going in to solve one problem, and find some other problems. When you get in the areas of cancer care and some of these other major surgeries, I imagine the same thing happens a lot in the mouth. When you open a tooth up, or you go into a gum, or you rego when you got a cut bone to do dental surgery or anything. But do you?
It can. There are always some surprises, or not always, but there can be some surprises. For the most part, as we've gotten better with our diagnostics, as technology's improved, the surprises are fewer and fewer. When I first started doing dental implants, I was doing it with an X-ray and tracing paper on top of the X-ray. I didn't have any idea of 3 dimensions. I measured the 3 dimensions with my fingers between the teeth, or from the bone, my fingers on the bone, or the gum tissue on either side, and kind of estimate with some probes or whatever we use. But things are a lot better now. The surprises are fewer and fewer. But you're right. You see what you see on an X-ray, or you see what you see in a clinical examination, but until you actually get in there, sometimes what you see is not what you expect. And boy, you better be prepared for those unexpected difficulties, because the patient has expectations, and we have expectations too. So we want to make sure that those expectations are met, and preferably are met the first time.
But dentistry and dental surgery, I think from a layperson's viewpoint, if I were to ask you a question, have you on one side and ask you a question, and a doctor on the other side, you pretty much can tell when you evaluate that person for the first time. I don't. Does it take long to evaluate a person, or does that first evaluation that you make when you see that person, are you able to pretty much formulate a complete plan, or how does it really work? Because you do a lot of advanced surgery that the normal dentist doesn't do, and I know that you use these scans and all-around mouth X-rays and everything to precisely place a dental implant. Because the same thing on surgery, because there was just something advertised in the paper the other day about knee stuff, and I'm very much interested in that, because right now I got a couple of knees that are collapsing, and I don't know if I'm going to be able to stand up or not. But I started looking at this stuff, and they're talking about pinpointing these injections into your knees, and one doctor does it just by sticking a needle in your knee and moving your leg around. Somebody else does it by using precise surgery. How in the world do people like me and John Harper, who's running the show, and Kerry sitting on the other side of the glass here, how do we know, as the people are the recipient of what you do as a dentist, how do we know that you've evaluated what we really need? Is that a fair question?
You don't, and you both had experiences in a dental office, probably multiple dental offices, and you start to get a feeling of confidence or lack of confidence based on the experience that you have. But if we're seeing a patient with complex needs, number one, does the patient want to have all those needs taken care of or not? Is the patient looking for that $1 million Hollywood smile, or is he or she just looking to be able to function on some teeth and just go through life. And so part of it is the interview process. But I got to tell you that, and I just ran a webinar with a group from Atlanta where the group was treating a patient, and I happened to have the opportunity of interviewing that group, and the group included a periodontist, a prosthodontist, who's one who specializes in tooth replacement, and an orthodontist. And sometimes, for those special cases, it requires a team of 2 or 3 to be able to, or sometimes 4, to really be able to accomplish what we need to accomplish. Well, part of that is on the patient side. Do we want to go to that extent? Do we want to be able to chew better, feel better? In this case, the patient had migraine headaches, didn't like the way her teeth looked. Her teeth were totally malpositioned. She had excess bone all over the place, so her teeth were short. So, and it required surgery, orthodontic treatment, and prosthodontic treatment in order to be able to get where that person wanted to go. Well, if that patient has a desire and wants to get there, wherever the there is, then that person needs to make sure that he or she is hiring the best team possible in order to be able to make sure that that work is done as well as possible with an experienced group of people that do the work. In this case, it was 3 specialists working together. You know, and we talked about this on the air before. Sometimes people don't know that they can see specialists without being referred from the general dentist. And that's becoming more and more of an issue now as general dentists are less and less likely to refer. So it becomes more incumbent upon the patient to say, hey, listen, this is a complex problem, or this problem isn't being resolved. Is there a specialist who can take care of that problem? Just as if you were seeing your general physician and you have high blood pressure, and the high blood pressure wasn't being controlled, or diabetes, and the diabetes wasn't being controlled, and I just saw patients like that 2 days ago, that you would go for, if your diabetes isn't controlled, you go to an endocrinologist. And I asked that patient, have you been referred to an endocrinologist? Because her family physician was treating her, and the diabetes wasn't under control. And the patient said, no, I have been referred to an endocrinologist. And I said, well, let me refer you to an endocrinologist, so that you can get your diabetes under control, which is going to help you dentally. It's going to help you help you generally. So you just don't have to say, hey, listen, things aren't going well. There are specialists in every arena, and it isn't just medicine and dentistry, that you as a patient could take advantage of in order to be able to get your problems addressed and solved.
You're touching on an area that I really want to talk about, and it involves how we take care of people that truly need advanced dentistry and how we might be able to accomplish that. And I'd like to talk to you about that after the break, Lee, because I don't want to break into it. You okay?
Okay.
All right. John, can we go ahead and take a break? Folks, we're going to take a break now because I want to get Dr. Sheldon in a conversation here that I think that more people need to understand. So stay with us because I think you're going to enjoy what we're going to talk about.
90.3 FM, you're listening to Helping Seniors of Brevard with your host, Joe Steckler, heard every Wednesday at this time, 12 noon to 1 p.m. on 90.3 FM. You're listening to Helping Seniors of Brevard with your host, Joe Steckler on 90.3 FM. Helping Seniors of Brevard, heard every Wednesday from 12 noon until 1 p.m. And right now, let's get back to more of the show, and here's your host, Joe Steckler.
Thank you, John. Welcome back to the second half of the show, folks. This is Joe Steckler. I remind everybody that this is a Talk to Me station, and that we are trying very hard to build a network. And the only way we can build a network, folks, is with you, our listeners, calling us, telling us what you want to hear. Call us and tell us by calling us at 722-9998, 722-9998. Tell your friends to listen. Tell your friends to call us. Thinking about it, it's a really, really cheap way to get advice. You know, you don't have to give your name. You don't have to do anything on it like that. You call in and say, I got this legal problem, or I got this tooth problem, or I got something. Where should I go? How can I get it fixed? And there's just a heck of a lot that we can tell you how to do that. And one of the things, I get so many calls that, because when Dr. Sheldon was talking about his experiences as an RE dentist, it reminded me that there are over 75,000 veterans that live in Broward County, and there are a heck of a lot of people that come in here that spent careers in the military and don't even know about all the stuff that is available to them. So it's really sad. And one of them that I'm very familiar with is ear care and audio aid help for veterans, because this VA clinic out here does a great job. Of course, they can't help it when the hearing aids come back to me from the factory still not working, but I'm going to go back and find out what's wrong with them. Nothing, folks, is perfect. Nothing will get done unless you make a concerted effort to try to do something about it. And that's the same thing that I would think that you, Dr. Sheldon, find, because I find the same thing. And let's just take the second half of the story and talk a little bit about stories. And one of the things, and maybe you could tell us a story, Lee, about, or is it possible? Let's say you do advanced dental care, you do surgery, you fix teeth, you make people have a capability to keep their teeth in. If they have false teeth, you can put a couple of implants in there and keep those teeth from falling out or moving around if you're trying to chew corn or bite corn off of a cob. There's a lot of people that have dentures. They have a hard time doing that because you got glue on the gums, and you got so many things we talk about. But Lee, in your time as a dentist, what do you do, or how do you, or is there a way to handle a case of a person, let's say, that they just simply cannot afford the advanced type of care that you need, that you can do, but you know that they need this in order to correct procedures so they can eat, so they can do things? Is there a way for people to get care like that? Is there anything you can offer on that, Lee?
No, I really can't, Joe, because understand that the advanced dental care developed when patients said, I'm dissatisfied with dentures. We need something better. So then you get a group of people like me who train on how to save teeth, if we're talking about periodontal work or root canals or that type of thing. And people like my son and prosthodontists who know how to, and other general dentists as well, who know how to restore a mouth and restore a mouth properly. But that's very time and laboratory intensive. So that if a patient wants advanced dental care, just like if a patient wants a fancy house, you just can't get that unless you're willing to or can invest the money to do it. There are a number of times when a patient will come in with desires, or even call us with desires, but if they don't have the resources in order to be able to take care of that, then we refer them to a denture dentist, somebody who does dentures on an economy scale, in order to be able to give them at least something that they can smile with and they can chew with to some degree. But if you want more than that, then unfortunately you've got to, maybe I shouldn't say unfortunately, but you have to, invest in that, just like you invest in anything that's a little that's beyond the norm.
No, it's a fair question. It's a fair answer. It's a good answer, because it's just like if people want elective surgery. Insurance doesn't pay for elective surgery. You make a decision that you want to do it. But it's, I guess that just like I get people calling me for help, I get so frustrated when I can help them, but the other kind of frustration I get, it's more like exasperation when I find out they haven't done what they should do. But on the other hand, I find people that that really need help but don't know what to do. I'm going to tell one story, then I want you to tell another story, okay?
Sure.
Okay. I had a phone call from a lady, and I'm thinking about this as I want you people who are listening to think about the feasibility of networking. And you could do this with dental problems, you could do this with medical problems, you could do it with just people problems. I had a call from a lady in South Miami, and I said, how in the world did you get our phone number helping seniors in Brevard County? And the poor woman said to me, she said, I got a problem here. My son is being operated on. He's in the hospital. She says, I have no other help. And she says, I can't do things for myself, and I have no help, and nobody said anything about helping me when they took him. And I said, what is the problem? She went from the fact that she had no food in the house, that the fact that the house needed cleaning, and she didn't know what to do about it. She did have money, but she couldn't get any resources in there. And I thought, holy smokes, I don't know anybody here. So I said, who gave you our number in the first place? So she told me that somebody in Melbourne told her it was a friend, said, if you can't get a problem, call Helping Seniors and they'll figure out a way to get you help. So I said, okay. So what I did, I said, what church did you belong to down there? She told me. And she gave me the phone number. I called the church. And the church says, we don't normally do things like that, Joe. But she said, now that I know about it, I'll stop by there after I get off work and I'll see what I can do. So she goes over there, and I get a phone call next day from the lady that called me. She was crying. And she said, the church people came on, they were really nice, and they got food for me, so I had something to eat, and said that this lady and her husband were going to come over the following day, which was last Saturday, and clean my house and get this thing all squared away, so when my son came home from the hospital, we could at least function. And I got to think about it. Now I have to call that. I don't have to, but I'm going to call that church and talk to the lady and see what really was the story. But it's networking. It's having just enough common sense to try to call a resource in another city. And churches are a wonderful source. They don't always solve the problem. I've had churches with 3 ministers turn me down for doing anything. Mm-hmm. But you just have to call the right place. So that's my story about networking. What's the dental story you want to tell me, Lee?
Well, let's go with the church story first, because I think the church story is important.
Okay.
And this may not relate to dental care, but let's talk about this. And that is that church attendance has dropped. It's dropped over the past 20, 30, 40, 50 years. And that's a significant problem because, societies in the past were reliant upon each other, or family members were reliant upon each other, and where families would coalesce would be under the roof of the church, and therefore you would have local solutions to local problems. And frankly, it works. It works at our synagogue. It works at your churches. I mean, it just does happen. And I understand you mentioned there might have been exceptions to the rule. There are exceptions to every rule, of course. But churches are, what are churches there for? They're there to help. That's what they do. And I would love to see that we kind of reverse our flow here. For years it was the church that was there to solve emotional problems as well as I was going to say financial problems, but we'll say physical problems. And somehow we've let the emotional problems go and say, well, we'll see the doctor, or we'll take a pill, or we'll do something like that, when in fact there is some fantastic counseling that can occur under the roof of the minister or the rabbi or the priest's office that can be very, very helpful. And it gets us away from this pill reliance that we have. So I would emphasize that certainly we get referrals from churches. We do, and it's nice, and it's good because essentially the churches or the people in the churches know that we'll be honest. So that is a big resource. You guys have any commentary on that? Because you're both religiously involved. What kind of resources do you have, or what happens, or is what I'm saying true?
Well, so I really have to agree with both stories, both the one that you, Dr. Sheldon, told, and also the one, Joe, that you told, because I use this all the time in the context of I do a lot of things ministerially, but also have a real heart for everything we do with helping seniors. And I oftentimes, whenever I'm asked to talk about what helping seniors does, I explain. I said, we're the little engine that could, and we may be one of the smaller organizations in Brevard County, but this little organization has helped over 2,200 different families resolve issues one case at a time since it's been around. And what happens a lot of times, it is just that personal connection where somebody explained what was going on for them, and somebody on this end was able to make a real caring and compassionate approach to trying to resolve the problem. And I know we've all heard that thing that they like to tell about, they saw the guy flipping the starfish back into the sea, and somebody comes up and says, why are you trying to help that starfish? And because there's hundreds of them laying out here. And so, well, it made a big difference for that one starfish, so I'm doing the best I can one at a time. And I think that's when you talk about sort of the aspect of what drives people who may be going to a church, a synagogue, or like that. That's part of who we are, I think, number one. But it's also the spirit that exists in helping seniors, where if there's a way that we can make a difference, we're going to try.
Well, I think, Lee, you might remember 15, 18 years ago when you were involved with me over at the Alzheimer's Foundation. We had an insurance company out, Mutual of something out in Minneapolis, Minnesota, that gave us $10,000 to help start a national network where we would try to get people to call other areas to help solve problems, and we tied that to the National Federation of Interfaith Caregivers, who had 2,200 organizations throughout the United States. And by having a book with those organizations, if somebody had a problem and they said, I need help for somebody in Wichita, Kansas, we knew that we had an interfaith organization in Wichita, Kansas, and we could call them and present a problem to them. They might be able to help, or they might not be able to help, but the chances were that there was some kind of help. And I'll go back and say one thing with what you brought up, Lee, because you brought it up, and Kerry pitched in on it. A lot of us forget that the rabbi and the minister and the priest were probably the most trained people in the early day, and they, in fact, were the physicians and the dentists and whatever they wanted to, however you want to call it. And I often wonder how they managed to get a tooth out, and I don't even want to think about it because it's bad enough with you pulling it out. But how they got that tooth out of the mouth without pliers, I don't know. Do you know?
I don't know what you're talking about.
I'm just glad we live today.
I heard that one before, so I can't help you with that one.
Well, you should, Lee.
Dental school's hard enough.
I forgot what it's like to hear you laugh about something. Okay, but Lee, get serious for a minute. But tell us about, you never really have said us anything about patients you've seen. Pick a good story about some patients that you've seen that people listening might be able to relate to themselves or something like that. I'd like to see what you come up with. And if you bomb out on the first one, let you tell another one.
Right. Well, let me say, the story that's nearest and dearest to my heart right now, and I've got a number, but the one that's nearest to me is Amy. And Amy gives me permission to use her name. She's even come to my dental implant lectures to talk with other people who are on the fence, who are considering getting dental implants done. So Amy's story is this. Amy came to me, and she had just gone through a divorce. And we get more of the story about what occurs because you develop relationships with people. And Amy had always wanted to get something done about her teeth. She didn't like the way her teeth looked. And there were some problems. We don't have to go into the details of the problems in the mouth, but the fact was there was something that could be done, and the husband had said, well, you know, you want to have nicer looking teeth, go get a denture. And she said, well, I don't want my teeth taken out and have a denture. So there was a stalemate, and she was upset. Well, the husband left Amy, and the husband left Amy for a woman who had a nicer smile than Amy did. So you can imagine how distraught Amy would be. So Amy came in to see us, and we talked about what we could do. And in this case, dental implants were the correct solution for her. And by the way, dental implants are not the solution for everybody, despite what you see on the TV commercials. It's not as simple as the way it's pointed out. And how do I know that? Because that's what we do. We do that work. We do that same work they talk about on the commercials. But for Amy, the answer was that. So we extracted her teeth, and we put some dental implants in, and on the same day we gave her some temporary teeth, which she was thrilled with. And by the way, that's the other secret. We don't extract teeth, put in implants, and have permanent teeth in there all on the same day. You get temporary teeth on that day, then a few months later we make you the permanent teeth. Because your gums need healing time between the time of the surgery, between the time of the extractions and the time we do the final teeth. So we give a patient temporary teeth, and then a few months later we make the permanent teeth once the gum tissues have healed to the final position. So we did that, and Amy was just thrilled with a smile. She gave the biggest smile. She gave the hugs. She was just so happy with the way her smile looked. Well, Amy posted a picture of herself on Facebook, and her high school boyfriend in California saw her picture and told Amy, that's the same smile I remember from high school. And you know the rest of the story, right?
I think so.
The two of them are back together again.
Yeah.
It's one thing to take out teeth and put in dental implants, be satisfied with the surgical results. But the result like that, where a new relationship established and she's just so happy, you can give me all the money in the world. It doesn't replace the satisfaction that you have when you help somebody get to that stage and improve their life.
Kerry, you're shaking your head. What were you thinking when he was talking?
I think it's a perfect story of. It was interesting because in that whole story that Dr. Sheldon was telling, you know, it's clear that the compassion and the caring part of this comes back through. So it all starts with, you know, do you have a little bit carrying on the conversation we were having even before the stories was. How do you find, you were asking a question in the first half of the show, you said, how do I find somebody who can help with a particular problem? We were using your knees as an example, but the question was, well, how do you know how to find it? You got to find somebody who has that amount of caring and that amount of compassion, which is what was evidenced in the story by what Dr. Sheldon was just telling about, the difference there, or the difference that you made in the lady in Miami who just didn't know where to turn, but knew that there was a lifeline called Helping Seniors of Brevard.
I'm thinking that so many of the calls are calls that can be resolved very easily simply because we can give somebody a number to call that we know will help them. And what people run across, and I'm sure Lee, you, because you were over at Temple Beth Shalom, and you were the acting rabbi over there for a while. And I'm sure that calls came into the church that that I would assume might have gotten to you, and you would have to make decisions. Am I wrong or not?
Well, there were a number of people who were helping at that time when we were without a rabbi, so it was not just me. I'm really the cantor. I know how to sing, so I chant the High Holiday service, which is very satisfying. But I've been president of the synagogue as well, and I've been involved in all aspects of that synagogue. And so, yes, people do come to our door. And by the way, they're not all Jewish. In fact, many are not. And we have resources that whether it's networking or whatever's there in order to be able to try to help people to move on. I mean, we all need a safety net to some degree.
But
the question politically is always what size net do you need, and then who's the best person to provide the net, and who's the best group. And I think that may be different for all of us. We're just giving some examples as to what's true for the three of us.
But Lee, you bring a point that I think that's one of the reasons we do a radio show and why we try so hard to bring information onto the show so that people understand. You brought something that more people need to think about, that the synagogue is and the rabbi is the same as the priest or the minister, and the same in the church, the synagogue. They're all equal. They perform the same mission, and there's so many things that are available to all of us that we don't really think about this day, and we forget that we are people, and that there are other people out there that think the same way we do, that would like to help us, and in many cases will help. And I'm amazed. We're doing our car raffle now, and the return that we've gotten from our donors is. I've been in fundraising for 30 years. I have never seen the degree of participation and not just the participation, but the amount that the people are willing to give. To me, it's a sign that maybe we're doing the right thing, and we're reawakening an interest in people that if we're going to solve one of these problems, people need to be involved at all levels. And that's the same thing in dentistry, Lee.
It is. That car raffle was fantastic last year. I imagine it's going to be even better this year.
Oh yeah. We're so excited when you have your choice now, the winner's choice of 2019 beautiful automobiles, a Dodge Challenger, a beautiful Dodge Ram truck, or even sporting around town in a spiffy red Mazda Miata convertible. People are reacting to this. They're excited. And they're excited about it for two things. Number one, it's just the excitement of that, going to the American Muscle Car Museum, being part of all that. But the other part is knowing that win, lose, the worst thing that's going to happen is you get a beautiful tour of Mark Pylock's amazing museum. But the best possible thing is you're going to win a car. But the most important thing is that you're making a difference because you're helping us with what we're doing with Helping Seniors of Brevard, which we've been talking about all through the show, is really the important thing that we do, helping seniors.
Right, and we got 1 minute to go, and I'd like to thank Lee and Kerry both for being on the show today, and just remind everybody that it takes a lot of people working together and to make something good happen. And we don't go out and solve everybody's problems, and there's so many times that we can't do what we would really like to do. But if we don't make an effort, then we never can say we tried. That's the same thing with you, Lee. When you slip with that drill and it comes out the other side of the gum, you're able to put something in there to stop the hole, right?
I'm not going there, Joe.
I just had to get that in there. I just had to do something with you, Lee. Thank you, Lee, for being on the show. And so thank you for listening. And I hope you've enjoyed our show today. Thank you. Bye, Kerry.
Bye.